Do you want to live your best life? Join me, Camille St. Ange, on this journey where we'll chat with people around the globe about how to have fun while finding balance in life. We'll chat with designers, makers, culinarians, and people of the crafty sort, and we'll help you find your creative gift in life. We'll also talk with health enthusiasts like yogis, CrossFitters, and nutrition gurus. And we'll even have a frank conversation about how you can live your best life by balancing art, body, and soul. Welcome to this episode of Art, Body, and Soul. Joining me today is Dr. Janine Kraus. Dr. Krause has been in practice for just shy of 20 years. Thank you for tuning in to the Art, Body, and Soul podcast. If today's episode resonated with you, please share it with a friend. And don't forget to subscribe so you never miss another episode. And if you're feeling generous, leave a review. It helps more people discover the conversations we're having here. You can also find me on Instagram and Facebook at Art, Body, and Soul or Camille St. Ange, and over at artbodyandsoul.com, where you'll find resources, programs, and a community waiting to welcome you there. Until next time, keep choosing joy, keep choosing health, and keep coming back to your body and soul. And I make it my mission each day to lift one person up, and I hope you'll do that too. Take care and be well. She is a doctor of naturopathy. And if you aren't familiar with naturopathic medicine, it's really about holistic wellness. It's working with the body to help the body heal within, in addition to using traditional medicines. Naturopaths, many of them, work directly with a Western medicine, traditional MD, and together they're able to bring a wonderful healing process. Rather than just treat symptoms, they work with the signals that the body is sending and help heal that way. Dr. Krause is going to talk about menopause today. She specializes in hormone issues, menopause, but also aging. And not just aging issues, but aging well, living for vitality, longevity, that's quality life. So you're active and vibrant through all of the years that you have in your lifetime. Dr. Krause also hosts a podcast called The Health Fix, and she has a lot of very renowned speakers on her show. And if you want to learn more about naturopathy, I encourage you to go over and check that out. Thank you for joining me and Dr. Krause for this really quick and down and dirty conversation about all of the things that women face when they hit the menopausal phase of their life. Hi, and welcome to another episode of Art, Body, and Soul. If you're new to this podcast, I want to share a little bit about what it is all about. So my name's Camille St. Ange, and I'm the founder of Art, Body, and Soul. And Art, Body, and Soul is a focus on holistic living. So that means how you move your body, what you eat, what you wear, what you think, how you live, where you go, what you do, how everything in your life can be tied back to wellness and taking a wellness approach. And in this particular episode, we're going to be talking with a naturopath, Dr. Janine Kraus, and she specializes in aging, but not just aging for symptoms, aging well, vitality, longevity, quality of life. She also specializes in people suffering with hormonal issues and menopause in particular. And that has been an area in life that women have needed some assistance with for decades and decades and decades. And she today will bring forward some of the myths that are out there and demystify what people don't know about hormone replacement therapy about what symptoms are really telling us about our body, the difference between issues with burnout and menopause, what you can do right now to start taking care of yourself, and what you can expect in the coming years. So I hope you enjoy Dr. Krause's interview with me. She's been practicing for just shy of 20 years, and she also hosts her own podcast called The Health Fix. We have a riveting conversation that is quick and to the point, and hopefully will help you understand where to begin on this particular part of your life if you're a woman entering the menopausal phase. Do you want to live your best life? Join me, Camille St. Ange, on this journey where we'll chat with people around the globe about how to have fun while finding balance in life. We'll chat with designers, makers, culinarians, and people of the crafty sort, and we'll help you find your creative gift in life. We'll also talk with health enthusiasts like yogis, CrossFitters, and nutrition gurus. And we'll even have a frank conversation about how you can live your best life by balancing art, body, and soul. Well, Dr. Krause, thank you so much for joining today. This is such an important topic, menopause and women's health. And I'm a little surprised that with as much information that's out there today, that I still talk to women every day who don't know what's coming or don't know what's going on, and they're really frustrated. But before we get into that, there's a couple of questions that are really important. That is also something that I'm surprised about, is a lot of people, even when they are seeing a naturopath, oftentimes don't understand what naturopathy is. And you are a naturopath. And I'm curious if you could just explain kind of the overall concept of what naturopathy is. And then what was your calling? What called you into this to become a practitioner of naturopathy?
Sure. Great question. Yeah, I like this question because it's true. A lot of people are like, what's a naturopath? Because we hear traditional naturopath, we hear naturopathic doctor, we hear naturopathic physician. Are we all the same? Well, it depends on what state you're in. But as a naturopathic doctor, in terms of the degree that I have, a doctor in naturopathic medicine, I went to an accredited 4-year school. I ended up there for 7 because I also did the acupuncture program, but traditionally it's 4 years. And then we do a residency on our own afterwards, or we can get enough training while we're in school. We're required to work with other docs. So we can have a residency within school. So really our training is very similar to a medical doctor, except we don't have as much as emergency medicine. And we have a whole year of counseling and a whole year of nutrition with whole foods cooking. So we get all of that wrapped in. And in addition to that, we have classes where we're talking about vitamins, minerals, supplements, herbs. And so the other half of our training is all learning, in addition to regular medicines, the immunologies and the anatomy and physiology. We're getting all of that training too. So a naturopathic doctor really is thinking like a medical doctor in a way, but we're looking at what caused the situation. We're looking for, everyone says root cause now, it's a hot topic, but we're really looking at what's going on, what created the dis-ease in the individual, and how we can work to establish balance back in the body using things that you might have to use medical intervention, like a conventional medicine, like an antibiotic if we have to, but we're going to try everything else first if it's safe for the person. So we're basically doctors that are looking at what's the cause. We're going to take a little bit more time with you if we're not in the insurance realm, because that's a whole nother story. And then the last but not least is we're going to try to figure out how to reestablish balance versus put any Band-Aids on things. And so that's a naturopathic doctor. And I was called to naturopathic medicine because my mom had breast cancer, and she was at first really struggling with it. And someone said to her, hey, there's this place in our town. At the time, it was called the Cancer Treatment Center of America. Now it's called City of Hope. And they call it the Chicago Clinic, but it's really in Zion, Illinois, where I grew up. And so what a blessing of all places, right there, boom, in my hometown. And so that brought me to naturopathic medicine. I actually wanted to be a pro snowboarder, and I was 15 at the time. And when my mom had cancer and she's going through everything, and really just watching how much better she did post chemo, post radiation, just overall in life with having the naturopathic doctors on board, I was like, this is really cool. And of course, acupuncture was part of that. And honestly, the Chinese medicine doc is who kind of really brought me in. And then the naturopaths kind of gave me more tools. And I was like, wow, I have so many tools if I do both acupuncture and naturopathic medicine. And so here we are. Yeah.
Thank you so much. What I have found is that naturopaths and traditional Western medical doctors really can work together. And there's so much that a naturopath can bring to somebody's life that is, like you said, you're not band-aiding, you're actually helping them heal using their body's own healing power. And, for my husband, he has found like a new lot in life by working with a naturopathic oncologist. And that has really helped him advance his health along with his other medical team. So thank you for sharing that. It's powerful when you see a loved one have something like cancer and how that spurs you to take action. So thank you. So here's something I want to talk about. Women, the top three symptoms. What do you see most? I think sometimes people mistake some of these things just for, it's just aging. And what are the top three things that you see, and how can you help people? How do you spotlight that this is a menopausal issue?
That's a great question. The first thing is typically fatigue. That's something that a lot of women are like, I'm just so tired. I'm crashing at the end of the day, or I'm crashing midday. I want to take naps, things of that nature. So fatigue's one of the biggies. Another biggie is digestive issues, whether it's gas, bloating, constipation. Some folks trend towards diarrhea, but shifts with the digestive system. And that usually kind of leans us into another one of the next most popular things is weight. A lot of folks are frustrated with their weight. And yes, there's hot flashes, there's night sweats, there's insomnia, tagged in here. But at the end of the day, when we're kind of teasing out all the symptoms, it's always going to come down to, I've got something going on with my weight. It's not coming down. None of the other tricks are working. I'm trying to figure out what's going on there. And then maybe someone will be like secondary, well, yeah, I am having some hot flashes, but the weight, the fatigue, and the gut stuff seem to be more prevalent in terms of the folks I'm seeing.
What is it a woman can do? You've got this weight, and I think it really kind of starts to go into, belly fat, right? It's a lot of, you see this belly fat, but how can women manage that part of their life without doing unhealthy diets? What is a good path? Because, there's this whole thing of you can't do a lot of intense workouts anymore because it raises your cortisol. Well, I love to run, is that going to raise my cortisol? Am I going to actually gain weight because I love to run? How do you help women approach that?
Yeah. One of the biggest things to recognize with all the information out there and everyone having their opinion on things, you are individual. We are all different. So you have to actually see what's going to work for you. And if you like to run and that's your stress management, why would we tell someone not to do that when that's their stress management? If you've got a bum knee and you're trying to run and you keep hurting yourself, okay, whole nother story. But what we want to look at,
Have you been spying at me?
yeah, there is, wow, and it is, a knee pain. If you ask me my number 4 and 5 complaints that come in, knee pain, back pain, those kind of things are definitely going to come in there too. But yeah, the pain is a factor, but we also have to step back and go, okay, we know that running, any exercise is going to up the cortisol. Well, it's what you do after the workout that makes all the difference. And if we look at the running and we're like, okay, great. I know that I'm pumping, I'm going. We just got to tell the body, I'm done with the workout now. You lay down, you put your legs up for 5 minutes, you breathe your heart rate down. Guess what? Cortisol's not going to be pumping anymore. And so there is that fine line where maybe women are doing 2-a-days or, doing a big run and then walking a lot later on. Maybe that could be a little excessive, but most women are going out for 30, 45-minute runs. I don't see too many people, unless they're training for marathons, the average woman's not going to be doing really big high mileage. So it's kind of looking at it and going, let's quantify this, because I've made all the mistakes in my practice. I've told people, lift heavy, don't do very much cardio. Guess what happens? They gain weight, they're mad at me. Same thing happened to me. I started doing a lot more heavy lifting. I didn't do as much cardio, gained weight. So like I tell every woman now in my practice, we got to figure out what's your sweet spot, but also what you're doing in that time frame after your workout. And then are you sleeping? What's going on with diet? Because there's a whole lot of factors involved in this cortisol component. But at the end of the day, I think we can get away with cardio. And I think it's strategic. I do a lot of sprint training too, 2 days a week, things of that nature. But I think that at the end of the day, you're really kind of figuring out, how can I shut that cortisol pump off? Can I test cortisol and see, like, is it out of whack? Is there anything I need to do there? And look at how your body responds. If you feel better and you're looking leaner and you're keeping it that way and things aren't going negative on you, then it's working for you. Let's not break something that's working.
Oh, the big takeaway and aha I just had an aha with that, is that it needs to be tailored, right? It's not look at a checklist. Okay, if I'm in menopause or I'm perimenopausal, this is what I have to do now. It's you have to tailor it to yourself, to whatever your system is going to do. That's so imperative. I think, people just don't even know that at all. We're all just looking at ticking these things off, because like heavy is relative too. Like, let's lift heavy, but it's all relative to what heavy is to you.
Yes. That just came up today in the office, actually, as to what is heavy, because we've got a lot of people lifting 20 pounds. That's heavy for them, but they're doing 10 to 15 reps. Now that could be cardio if we look at what your heart rate's doing.
Yeah.
And same thing, people could argue cardio with lifting 4 to 6 reps at like 50-pound dumbbells. So we have to think about what we're doing here, because the heavy thing, and I'm going to say this over and over again for women, is if you're lifting heavy, that means your last 3 are hard to get up. If you're doing, say, chest press or something, that is hard, or you're doing a row, those last 3 are really hard to do. And you're doing 4 to 6 reps, you're at hypertrophy, meaning like you're gaining muscle reps, not 15 over and over again at 20. That's not heavy. That's almost a cardio workout, which is another reason why some people aren't losing weight too.
Yeah. I think, we just, as your body changes, it kind of hits you, all of it. So here's, I'm thinking about the women that I talk to in my own experience, and that's all of a sudden, I'm not, and it feels like it just happens all at once, but looking back, I think it's kind of like a crescendo. Not sleeping. My energy might have these huge energy drops. I feel like I'm higher stressed now, and I've got weight gain, hot flashes, mood swings. Right? It's like a wrecking ball. Right? It sounds like a wrecking ball. And so, where do you start with someone who has been hit with all of these systems or symptoms head on? What's the starting point? Because it's like, woo, you just hit them all.
So usually what I do at this point is we try to figure out how we're going to clean the slate. So I often will start, and this is something I've started to really implement even this year, I would say, is a 21-day metabolic reset cleanse. We just level the playing field, because when there's so many things going on, it's easy to chase symptoms. And I will fully admit, I've went down that path of chasing symptoms. And it's looking at, okay, we got to reset. And then after that, it's looking a lot at the nervous system, because what throws us into disease and having issues is that darn nervous system can really get in the way, since we're changing fuel from the ovaries to the adrenals, and those adrenals are so tied in to the fight or flight nervous system. We've got to address that too.
Yeah. So you just named off a huge number of things. You talked about the nervous system, and I think about people trying to parse out, is this my nervous system from all my hormonal changes, or am I in burnout? Right. And how do you parse that?
It's hard, because at this phase in life, we're at a turning point where for a lot of women, they're trying to decide, am I done with the career? Am I leaving something behind? Am I moving on? Is it time to do that? And we want to kind of blow stuff up a lot. First and foremost, the way to look at it is like, okay, let's look at the hormones. Like, let's see where you're at and get a baseline. And, the testing on that, we can go into that if you want. There's different versions, and there's plenty of docs that are going to argue which one's the best, and some don't do any testing. There's a whole gamut of which direction you want to go. But at the end of the day, I feel like we need to know what's going on with the hormones, what's going on with the thyroid, what's going on metabolically. So what are we doing with the blood sugar here? What's the kidney and liver up to, especially the liver, since this can be part of the problem. If the liver slows down to detox, we can be a little bit more toxic. We can have brain inflammation, and the brain inflammation shows up like so many women in perimenopause and menopause get diagnosed with ADD and ADHD. Is it that, or is it the hormones? Is it overwhelm? Is it burnout? It's hard to tease it out, to be honest with you. But at the end of the day, labs can tell us one thing, and then really having a hard talk and being like, are you happy? Is your life stressing you out? Could it be both things coincidentally happening at the same time? And I personally think that it is kind of our energetic time frame where we're meant to turn into the woman's wisdom, holders that we are. This is our time to turn into, sage wisdom. And I think that is like the turning point for us. Are we going to follow our path, or are we going to stay and grind at whatever we don't really love anymore? It's interesting to think it through.
So, you talked about hormones, and a lot of women don't know what is when we talk about menopause and hormones, what's happening. It's not just one hormone, it's the S, the plural, it's the hormones. Can you share a little bit about what happens with hormones? And then you mentioned hormone therapy. What's a common myth that women might, can you demystify any myths out there?
Where do I begin? Okay. So we've all, like myself included, when I was in school, we still were going off of the World Health Organization's research study that told us that hormones cause cancer. And so I didn't learn a ton about bioidentical hormone replacement therapy in school. I had to go take classes. I had to work with a great doc, Pamela Smith, who helped me a ton. She's a medical doctor, not a naturopath, but she worked within a clinic that she did a lot of virtual, but also she worked within a company called PCCA. They're a compounding formulator company. And so I got to learn a lot of training from her exactly with the compounding pharmacy. But where I'm going with this is that, myths, we've heard them all, from cancer. You're going to gain weight. You're going to lose weight with hormones. You're going to keep getting your period. You're going to stop your period. I mean, it's all over the place. You're going to mess up, other things. And then at the end of the day, it's also the question, and this maybe is not necessarily a myth, but there's the question of, aren't we supposed to get older? And aren't we supposed to decline on our hormones naturally? And are we messing with nature? And so we've got a lot of different thoughts here. Now, I can basically say that the breast cancer myths, like you do hormones, you get cancer, that's been debunked. That you can look at all the new research on that has completely been debunked. Have I had women that have used bioidentical hormones in my practice and ended up with cancer? Absolutely. And this year in particular, I've had two. And are they okay? Yes. It was caught early, but were they on high dosages? No. So this is something we have to think about. Lifestyle factors do interfere when you do take hormones. Alcohol boosts your hormone, estrogen in particular. You have to think about that. You have to think about all your processed foods. So I am never going to be a person to say that bioidentical hormones are completely safe, because I don't know what you're doing at home. You may tell me one thing, but there's other factors. We have genetics too that are at play in here. So are they 100% safe? No. Are they a lot safer than we thought they were? Yes. How do you manage it? You got to just keep testing and do yourself breast exams and take care of yourself. Like that, at the end of the day, that's what's going on there. Now, regardless of what someone thinks about how we get cancer, all those things, sure, there's emotional components. There's so many different directions, but that's one of the biggest myths. The other big thing that TikTok always tells people is like, you're going to get on hormones and you're going to drop weight. I wish that was the case. I've maybe seen like 5 women in my whole practice, and I've been practicing almost 19 years now, actually lose weight when they started hormones. I don't know who these people are, but it's not in my world. Maybe I see more complicated cases. I don't know, but it's not the weight loss. That's not going to happen. That is a myth. That is a myth. You are lucky if you lose weight when you get on the hormones. Those are kind of the two biggies, though. The other myths that I will sometimes hear is that you can only start hormones when you have not had your period, when it's been 10 years, like if it's in that 10-year window, you can start them. Not true. We can start them whenever we want, and you have to be on them for life. Also not true. You can stop the hormones whenever you want, and you can't be on them for life. You could also be on them for life. I have women in my practice in their late 80s still on hormones, actually back from the 60s. So, or their 60s, sorry, not the 60s, but when they were in the 60s. Different story. But yeah, I've had women, 20 plus years on bioidentical hormones, and they have not gotten cancer. They're absolutely fine, and they have aged well. So there's lots of things out there. And once again, I'm going to sound like a broken record. Everyone's individual. We have to be paying attention to that everyone's individual.
Thank you for demystifying the cancer scare around hormone replacement therapy. I know so many women in my career that I talked to avoided that because they just thought that was a given, and that's not the case. I mean, everything actually has, I think everything in the world has some risk, cancer risk, right? That's just, like you
Absolutely.
said, alcohol, processed foods, lifestyle choices, right? There's all of these things, but I mean, it could be just a teeny tiny amount, and everybody's different. Like you said, you don't know what they're doing at home. So thank you for demystifying that. I think it's so important that women have this as an option. In fact, because bone density and, muscle loss too is another component of people hitting menopause. And what would you tell a woman today, thinking about there's fat, there's that they can gain, there's sleep issues, there's, cognitive issues, there's bone and muscle loss option. What if somebody was to today, you had a patient come in where, and, and you're tailoring it, but what's one thing that somebody could do today just to start in their journey to start but taking better care of themselves at the beginning of the menopause?
Number one, hydration. And it seems dumb, but a lot of us forget to drink water. And if we look at what menopause is, perimenopause and menopause, it's yin deficiency in the Chinese medicine world. And that is becoming deficient in fluid. That's why we dry out, the vaginal tissue dries out, our mouth dries out, the eyes dry out, your hair dries, your skin dries. This is something we want to be thinking about. Like, are you hydrating? Wow. So that's probably the number one thing I have people look at. And not only that, are you drinking good, filtered, quality water? Because if you're drinking tap water from a city, you're not getting chances are you're getting some toxins in there. And I'm sorry, but your refrigerator, that fridge filter is not strong enough. We need something that is charcoal and also includes some reverse osmosis in there. So I'm a fan of the countertop ones like Aquasana and different brands of that nature. I used to be a big fan of the Berkeys until the filters became difficult to get a hold of and other questionable things. But nevertheless, having something that's a higher grade and testing it, see what's happening with that filtration. Because I do believe that clean water and actually hydrating it is a part of one, our birthright to have good clean water, but also staying hydrated is number one. It's huge.
Well, all of our organs, I think about our organs, if they're not hydrated, how's the whole machine, right? How's the whole thing going to operate well? You've got to get some water in those organs.
Mm-hmm.
Yeah, in my business, I'm always promoting people to, number one, start hydrating just because you feel so much better. I know I think better, my food processes and digest better. I sleep better. Everything's just better. And I've been following the Mayo Clinic's recommendation of, 88 ounces at a minimum, right? 11 cups per day minimum. So that's my minimum goal. So in terms of supplements, naturopaths are known for really getting good supplements to people so that, their stomachs works well, their mitochondria's doing all the things that it should be doing. In your top three that you use in practice, what are your, and you might say top three is dependent upon what the issue is, right? But related to menopause, what would be three supplements women could consider that would be helpful?
Sure. So magnesium is always going to be one of my number one supplements because it does so many things. It helps with blood sugar balance. It helps with relaxing the muscles. It helps us with going to sleep. It can help with our moods. So that one is ubiquitous. Everybody in my world is going to get recommended that, no matter who you are. Dosing varies is pretty much that. And then topical is actually one of my favorite ways to get in magnesium. I
Oh, okay.
absolutely love it topically. I don't live without it. In fact, there's probably one right behind this computer screen that is here,
Okay.
which is funny. I don't know, but there is one. I'm not going to reach around, but it's always. And so putting it on your feet at nighttime, putting it on your calves, putting it behind your ears, great spots. The other big one is vitamin D. You got to know where your vitamin D is. You got to get it tested. If your doc won't test it, you can walk into a walk-in Quest or LabCorp these days. Just get it tested, know where you're at. I think everybody to many levels can benefit from the vitamin D. And so those are like my top two. When it comes to top three, this is where we might vary a little, but honestly, I really think folks need a good multivitamin. Something basic, doesn't have to be fancy. I use Designs for Health brand, twice daily multi. It's got higher amounts of B vitamins. And for women moving from perimenopause into menopause, we need more of the B vitamins for the mitochondria. So I will typically use that one. Also another brand called Integrative Therapeutics, and I use their Pro
Oh,
Thrivers quite a bit because it's on a lower level on the B vitamins, but it kind of covers a lot of what we need. So those would be my top three for anybody and everybody.
excellent. And then for women who are in menopause or perimenopausal, if they do nothing else this week, what do you think they should do to start adjusting? They're at the beginning stages of menopause. What's the first step?
I'm going to go to the nervous system on this one
Okay.
because it is so important for us to get that transition of the fuel from the ovaries to the adrenals. And if nothing else, we preserve when we get stressed, we preserve when we work out, like I mentioned earlier. So the idea becomes find something that helps you to de-stress. I don't care if it's dancing, if it's rocking, if it's running, if it's, Tai Chi, whatever it is, something to decompress at the end of the day, even if it's a bath, like an Epsom salt bath every night.
Yeah.
Awesome. Something to bring the cortisol down and just have joy and relaxation.
Well, that's a big trend for 2026 in the wellness space. It's do less, live
Yes.
more. And stress, stress is just like the antithesis to joy. It's the thief. So, well, Dr. Krause, thank you so much for spending this time with me and listeners at Art, Body, and Soul. This is so good. And thank you for all the help that you give not only women who are facing menopause, but just people who are all on the spectrum of some kind of health need. So thank you so much.
Oh, my pleasure. Thanks for having me on, Camille. I appreciate it.
Yeah. Thank you for tuning in to the Art, Body, and Soul podcast. If today's episode resonated with you, please share it with a friend. And don't forget to subscribe so you never miss another episode. And if you're feeling generous, leave a review. It helps more people discover the conversations we're having here. You can also find me on Instagram and Facebook at Art, Body, and Soul or Camille St. Ange, and over at artbodyandsoul.com, where you'll find resources, programs, and a community waiting to welcome you there. Until next time, keep choosing joy, keep choosing health, and keep coming back to your body and soul. And I make it my mission each day to lift one person up, and I hope you'll do that too. Take care and be well.